Now, a core part of opening up safely is having an effective testing and tracing process.
If any part of life is going to get back to normal before a vaccine, experts say we'll need a lot of testing and contact tracing to see how COVID-19 is spreading.
You're good to go?
And on April 27th, during his reopening announcement, Governor Greg Abbott said the state would build a force of 4,000 contact tracers in the month of May.
We are Texans. We got this.
Just 16 days after his announcement, Texas selected the bid of a small company from Frisco to do something it had never done on its own: set up a virtual call center. The company's background is using Salesforce technology to help with data management.
The state of Texas has kind of taken the attitude of damn the torpedoes, full speed ahead.
Republican State Representative Steve Toth is on the state's Appropriations Committee, which oversees how the state spends money, and he wants the contract canceled.
You know, before you do something like this, you should actually talk to people that know something about it, and they didn't.
He has concerns about everything from the $300 million price tag to the lack of information about how personal information is being protected.
It's just wrought with problems.
Democratic lawmakers like Donna Howard, a nurse also on appropriations, say contact tracing is too important to trust to someone unproven.
Why this particular group was selected is unclear at this point in time. Yes, I still have concerns about a lot of this.
Here's why it matters. Contact tracing is when health officials or call center workers contact people who have tested positive for COVID-19 and then reach out to people they've been around.
Ultimately, that's one of the major tools we have in our toolbox, is to get the word out to people.
UNT HSC professor and epidemiologist Dr. Diana Cervantes says the state doesn't have enough contact tracers to do the job right now. When Governor Abbott announced the goal of 4,000 contact tracers, the state was averaging under 850 cases a day. Now that's 7 times higher, up to roughly 6,000 cases a day.
There's no way 4,000 people can make this work. I don't know that 40,000 people could make this work. It's a joke.
George Washington University researchers built a model using case counts and normal workloads that estimates Texas needs at least 15,000 contact tracers now.
Because it is time consuming, you do need a lot of people to be able to do it. And every day when I see on the news that there are 800 cases, 1,000 plus cases, you have to consider that as somebody that the health department's going to have to reach out to every day.
But Texas has not hit its goal of 4,000 tracers. In the contract, MTX says it can source up to 1,000 call center agents every 2 weeks. But in roughly 3 months, they've hired 605, which they say is all the state would allow. We asked Governor Abbott about the shortfall, and he didn't provide a clear answer.
So we're at a stage now when you have community spread. The goal is to go into the community and test as many people as you can.
The State Department of Health and Human Services said no one would answer questions about the contract on camera, but said the call center had enough contact tracers to do the work it has been tasked with.
If we don't do this, then we run the risk of not being able to fully reopen our economy, and certainly run the risk of not being able to have our children back in school.
There are other goals laid out from state officials that haven't been met either. The state set a target of hiring around 500 unemployed workers from the Texas Workforce Commission for the jobs. But so far, they've hired just 18 who didn't start till August, according to DSHS.
It happened because the state of Texas was given a bunch of money by the federal government without any accountability, without any strings.
Both Howard and Toth have concerns about the bidding process. MTX beat out big names like AT&T and IBM and tied with Accenture in bid scoring, which said Accenture had, quote, extensive current and previous experience, but MTX was about $15 million cheaper. A company spokesperson said in an email, Texas is the first virtual call center we've stood up. They say they've assisted other companies in running call centers before.
We don't care that the CEO of the company has never really performed anything of this magnitude before.
Then there's another questionable claim. MTX says on its website that it has the only contact tracing tool endorsed by the CDC. The company's CEO made the same claim in a video posted to LinkedIn.
Really excited to announce that CDC endorsed MTX's contact tracing solutions.
But we asked the CDC, and they told us in an email, quote, CDC does not endorse specific digital contact tracing apps. We asked to speak with MTX's CEO, but the company declined. In a response to the CDC statement, MTX emailed they have now modified how we talk about the CDC's feedback to be more precise.
It's ridiculous. This is a company that has no qualifications to do this, and yet they've been awarded a $295 million contract.
Toth is one of several Republican lawmakers now suing Governor Abbott over the deal, criticizing the company's lack of experience and saying the bid is illegal and was never public. We asked the governor if he'd cancel it.
We will always be looking to make modifications as needed.
The health department and MTX have promised every employee hired is from Texas, but Howard and Toth both want more oversight and checks.
I've continued to reach out and ask for information. I'm just not getting it.
Howard says the $300 million contract is vague, so it's unclear exactly what MTX is supposed to deliver or how performance is judged.
I think that's part of the problem is we don't all have that information. And unfortunately, transparency is a big part of this. And it seems to be that we are dependent upon investigative journalism to get the questions answered that we all want to answer.
Texas health officials continue to say one of the state's best weapons against the virus is working as planned, even as cases surge and lawmakers say the effort is failing.
We've got multiple issues here: inadequate testing, inadequate labs, inadequate tracing, and at the same time, we're experiencing a surge. This has got to be addressed.
In Fort Worth, I'm William Joy.